Welcome to the 1669th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for a minute. Thank you and welcome back. Today we have with us Dr.NIKUNJ TRIVEDI, MF Homeopathy, London, Artist Clinic, UK since 1980. Artist Advanced Clinical Homeopathy Center. We all know that Dr. NIKUNJ TRIVEDI, a wonderful personality, a lot of intellectual work, practice, as well as a lot of lectures in this platform too. So today's topic is multiple sclerosis in homeopathy. On behalf of IFPH, welcome Dr. NIKUNJ TRIVEDI, sir. You can have the platform for the next 45 minutes. Over to you, sir. Please proceed.
Hello, everyone. Am I audible?
Yes, sir. Yes, yes.
Okay. So, namaskar to everyone. And thanks for inviting me for this platform for presenting my views on the multiple sclerosis. I heartily welcome to all the participants, those who are attending this webinar on the IFPH platform. And IFPH is doing a wonderful job because today is 1669th day that what we are sharing all the potential homeopaths' thoughts on this platform. Really, I'm honored. And now I'll start my presentation on multiple sclerosis. And am I allowed to share my screen?
Yes, sir. Sure.
Okay. Can you see the presentation now?
Yes, sir. Yes, sir.
Okay. So multiple sclerosis, it's a neurological condition. And it is day by day increasing. In UK, the statistics shows that in a past year, it has been increased by 13%. So more than 150,000 patients are suffering with the multiple sclerosis in UK. That's what statistics says over here. Today, we are going to discuss about the causes, its effect, and homeopathic therapeutics about the multiple sclerosis. It's a slowly progressive CNS disease characterized by disseminated patches of demyelination in the brain and spinal cord, which results in multiple and varied neurological symptoms and signs with remissions and exacerbations. Patient sometimes gets better and sometimes gets worse, but patient never get rid of this condition. In short, multiple sclerosis is classified as an autoimmune inflammatory disease, where body's immune system mistakenly becomes our body's enemy. It produces antibodies, and that causing a problem with the scarring, with the ulceration on the spinal cord, on the nerves, and it disrupts the nerve communication between the brain, which damages the protective covering of the nerves, which is called the myelin. Myelin sheath is just like insulation on the electric wire. When the insulation gets corrupted on the electric wire, it starts causing a spark that we almost everyone has experienced. The same way, the myelin sheath, which is made up of the fat, when it gets corrupted, when it gets ulcerated, when it's having a sort of a damage, then there is a disruptions in the nerve communication, and patient is developing a various type of symptoms with various type of system. So it can lead to variety of neurological symptoms, including lot of complications, and that what we are going to witness today. So multiple sclerosis is first described by Jean-Martin Charcot in 1868. Jean-Martin Charcot was a French neurologist. He was born on 29th of November 1825 and he died on 16th of August 1893. So during the span of his 68 years of career, he was dedicated to the neurology and he gave a lot and loads of more than 15 eponyms to the neurology. And one is the Charcot stride. Because when we come across any neurological condition and when we examine our patient with certain type of examination, that examination is related with the name of the neurologist. And Jean-Martin Charcot is very famous for his contribution to the neurology, and that's why he was considered as a Napoleon of the neurosis. He was considered as a father of French neurology, and he gave a good neurologist as his student. And everyone knows about Sigmund Freud. He was also a great psychiatrist in the world, and still we are using the reference book and his books to study the psychiatry. Same way the Tourette, George Gilles de la Tourette. We studied the Tourette syndrome. That is because of the Dr. Jean-Martin Charcot, because Dr. Tourette was his student. So that's why we are remembering Dr. Jean-Martin Charcot as a father of neurology. So he described the multiple sclerosis as an inflammatory disease. He found that the fatty myelin sheath around the axons of the neurons in brain and spinal cord are damaged. And that's why we call as a demyelination. That demyelination is present with the scars, different ulcer type scars on the neurons. And onset of multiple sclerosis is always starts from the young age, and which is more common in female rather than male. It's an immunological abnormality. And the classification of symptoms are as per the system. So we consider the central spread of the sclerosis. So central spread of the multiple sclerosis is always presenting with the fatigue. Patient gets tired, unexplained fatigue. Initially, patient never comes to us that, oh, I'm a patient of multiple sclerosis. When we investigate, then we can come to know that patient is developing a multiple sclerosis. So initially, patient always comes with the fatigue, tiredness, unexplained lethargy, just like a lachesis. In lachesis, patient is lethargic, patient is indolent, patient having a burning, patient doesn't want to do anything. Patient becomes a couch potato. So this is the fatigue is very, very important. And there is a cognitive impairment. Patient does not have any sense of orientation. At the time of laughing, patient is crying. At the time of crying, patient is laughing. So there is a cognitive impairment. And this cognitive impairment is gradually spreading with the depression. Patient become depressed. Patient in unstable mood, just like a pulsatilla. Pulsatilla patient weeps very easily, and there is a sudden change in mood. So cognitive impairment, depression, and unstable
Unfortunately, some network problem is there. So please wait. Yes, sir is again joined. Yes, it's a neurological problem of our network. Yes, sir, please, sir. Yes, sir, please. Please unmute, sir. You're muted, sir. Please unmute.
Am I audible now?
Yes, audible, sir.
Okay, okay, fine.
Please restart screen sharing. Please restart, sir.
Yeah. I'm again sharing my
Okay, sir.
presentation. Okay,
Yes, sir.
is it visible?
Yes, sir.
Okay, so I was talking about the dysarthria.
Yeah.
Incoherent speech, patient having a stuttering in initial stage, and then the speech becomes very slurring speech. Then comes to the musculoskeletal. Musculoskeletal system shows the weakness, spasm and ataxia. Weakness in the limbs, spasm in the limbs, and ataxia. Patient drops the things readily from the hand. Then patient having a nystagmus, means oscillatory movement of the eyeball. Patient is developing optic neuritis when ophthalmological examination is being carried out. At that time, ophthalmologist can find that patient either is developing optic neuritis or ophthalmoplegia or nystagmus is visible. And if you want to experience the nystagmus in a normal patient, a normal person, then just look at the railway station, those who are standing. When train comes, at that time, look at the eyeball of the person. You will find the typical picture of the nystagmus over there. So you will never forget that experience. Okay, now coming to the diplopia, double vision. Patient is complaining of the double vision, and that diplopia is because of the images which patient carries from the eyes to the occipital lobe. And because there is a scarring, patient is developing a diplopia. Now coming to the throat, patient is developing a dysphagia, means difficulty in swallowing. So remember, whenever I'm describing all these symptoms, you will get all the clues of the one remedy. And patient having a sensation of the pain, hyperesthesia, patient feels with the slightest touch or with the slightest bang, patient is feeling a severe excruciating pain that is because of the conduction of the nerve. The nerve impulses is being carried out in such a vague way because there is no covering. And whatever covering was there, it has been ulcerated, it has been demyelinated, it has been scared. That's why patient having a hyperesthesia and paresthesia. So this all about the central, vocal, musculoskeletal, visual, and throat symptoms that what we have described over here. Now we are going to another slide. Yes. Bowel symptoms. These patients having all the time incontinence. Either it's a rectal incontinence or urinary incontinence. Patient having a diarrhea or constipation. So diarrhea and constipation alternates. And same picture we are getting in a patient of hypothyroidism. Hypothyroidism patient also having a diarrhea and constipation is alternating. So this is very good clue for the differential diagnosis. Urinary incontinence is also there. Patient having an increased frequency of urine, and sometimes patient comes with the retention of the urine. So this all about the urinary symptoms. Now, we are coming to the etiology, that what can cause the multiple sclerosis, and which is absolutely unexplained, means unknown. Majority of the patient condition where the etiology is unknown. But here, as it's an immunological abnormality, it's an infection by slow or latent virus, which can cause the myelinolysis, means the breakdown of the lysis of means breakdown of the myelin sheath by enzyme secreted by the virus, where the immunoglobulin G is usually elevated in cerebrospinal fluid. When lumbar puncture is being carried out, when we check the CSF report, we find that immunoglobulin G is elevated in this patient. An elevated titer of IgG associated with a variety of viruses like measles. And measles is caused by Epstein-Barr virus. And here I am showing you the picture of Epstein-Barr virus. These two arrows, if you can see these two arrows, these are the viruses. The magnifying picture of the viruses that is supposed to cause the disruptions in myelin sheath, and which can scarring the myelin sheath, causing the multiple sclerosis. Another factor is genetic susceptibility. Some theory says that it's a genetic condition and some genes are susceptible for the onset of multiple sclerosis. The age of onset is between 20 to 40 years. Young patient, they develop multiple sclerosis at the age of 20. Up to age of 40, patient is developing this, but after 40, chances are rare. But before that, already this disease has been set in its full fledged. So in terms of gender, woman gets more affected than man. Environmental factor is also very, very important. It is more common in temperate climate, and ratio is 1 into 2000. Out of 2000 patients, one patient is catching the multiple sclerosis in temperate climate. And in tropic climate, out of 10,000 patients, only one patient is catching the multiple sclerosis. So age of onset is 20 to 40 years, as we discussed, but MS is linked to the geographical area where a patient's first 15 years are spent. Relocation after age of 15 does not alter the risk of multiple sclerosis. This is also a very important factor to consider. Now, what are the symptoms we find when patient comes to see us for the first time? Considering the mental symptoms, in homeopathy, we are always being more important to the mental symptoms. And with that, we can find the real constitution of the patient. So mental symptoms shows the patient is apathetic. Apathy is the first symptom where we can give some clue about the multiple sclerosis. Patient has lack of judgment. Patient is quite inattentive when you are talking to the patient and patient is not listening to you, or patient is doing something else. Patient can't take any judgment. Instead of taking a pen from the table, patient's finding something else. Also, patient has emotional liabilities. Patient is very emotional, just like a pulsatilla patient, as I explained earlier. frequent mood swings, and sometimes it gets confused with the hysteria. And the diagnosis of multiple sclerosis was being established by Dr. Charcot with the hysteria patient. So he was confused with the one patient, one lady patient. She was complaining with the hysteria, and that was turned into the multiple sclerosis. So that's the basic story after it. Patient always having a euphoria, or patient either having a reactive depression. Patient gets depressed very easily, and that depression is making patients to feel indolent, lethargic. As we discuss about the mood swing, sudden weeping, or forced laughter. I don't know whether have you seen the movie Joker, English movie? If anybody has seen the movie Joker, in that movie, the main character is laughing like anything, irrespective of the place. And it was a so loud, weird laugh. Even in police station also, he was laughing. And patient have a neurological condition. It's a typical case of multiple sclerosis. If you are getting any chance to see the Joker English movie, then definitely watch it. You will never forget the picture of multiple sclerosis. You will never forget that. Sometimes this impression we carry in our mind after looking to the character, we always remember that disease. That laughter. Actually, I was trying to embed that video with my presentation, but I was remain unsuccessful. Otherwise, I would have shown that how that laugh was. And really, and you feel with the laughter, you feel pity on the character. And it's really difficult situation that whether patient is laughing or patient is crying, you can see the crying, that laughter. That's the charm of the character which has played, and this is a typical picture of the multiple sclerosis. So this forced laughter, because of the involvement of the corticobulbar pathway of emotions. Patient sometimes developing a convulsive seizures as well, but it is occasionally occurs. And as earlier I told about the scanning speech, dysarthria, which turns into the scanning speech. So slow enunciation with a tendency to hesitate at the beginning of the word. And when we diagnose this patient with our homeopathic remedies, so gelsemium is the medicine where patient is developing a nominal aphasia. Patient having a hesitancy initially. When patient try to talk, patient hesitate. Patient doesn't find a right word. The same thing you will find with the multiple sclerosis patient. And now we are coming to the involvement of the cranial nerve. So ophthalmologist diagnosed with the initial optic neuritis, partial optic nerve atrophy with temporal pallor, changes in the visual field. That's why patient is developing diplopia, ophthalmoplegia, transient, slowly patient is developing ophthalmoplegia. Patient is also developing a diplopia that we find with the gelsemium. And from the involvement of the brainstem tract connecting third, fourth, and sixth nerve nuclei, all the ophthalmological symptoms being taking place. Patient is developing a nystagmus. So here I have put a small slide animation of the nystagmus, that how patient's eye move, and occasionally deafness and vertigo because of the involvement of the trochlear nerve and abducens nerve. Now sensory symptoms. Patient is developing a paresthesia, numbness and blunting, unpleasant sensation. Anything you do for the patient will not feel happy, and the patient complains that I don't get joy. And here, present I'm treating one lady patient. Whatever I do, whatever remedy I give, and whatever efforts the family members are putting to please her, she is not getting any joy anywhere. So it's a very typical symptoms, that unpleasant sensation, blunting, numbness, paresthesia, complete loss of any form of cutaneous sensation, which is very rare. If you pinch the patient doesn't feel any sensation, but which is very, very rare. That happens in absolutely advanced condition. Now, what are the autonomic nervous system symptoms that what we are getting from the patient is urinary urgency or hesitancy. Patient cannot hold the urine. Once patient develop a desire to pass urine, patient has to jump and patient has to run. Slight incontinence, partial retention of the urine. When we do the USG, means sonographic examination, at that time we can find some residual urine in the bladder. And that residual bladder may invade infection later on in his life. That retention is also leading to the thickness of the bladder mucosa. That retention is also causing patient to dribble. Now coming to the sexual importance in men and genital anesthesia in women. Because there is no nerve conduction. Because of the scarring on the nerves, that pathway of the pleasure is being interrupted. So male patient is developing impotence, erectile dysfunction, and in female, they don't get any orgasm because of the genital anesthesia. Bladder and rectal incontinence may occur in severe advanced cases. So if patient has been diagnosed for multiple sclerosis today, then you may find the bladder and rectal incontinence after 4, 5, 6 years. So we talk more about the Dr. Charcot, Jean Martin Charcot, and this is the Charcot stride. What Charcot strides telling us that patient is having a nystagmus, patient having an intentional tremor. That's what I'm going to show you. If you tell patient to pick anything from the floor, so when patient's hand goes towards it, patient develops tremor. At the rest, patient is okay. But when you tell patient to pick the pen or pick something from the floor or something from the table, when patient approaches the target, patient start developing a tremors, shaking. So that is intentional tremor. And Jalsaman is also again remedy for the intentional tremor. And as we discussed earlier about the scanning speech with mild dysarthria. So this is the Charcot stride. Charcot stride is nystagmus, intentional tremor, and scanning speech. So now we are coming to the pathology. Flux of demyelination along with the destructions of oligodendroglia and perivascular inflammation. The blood vessel is also getting inflamed because of the inflammatory condition, autoimmune condition, and these perivascular inflammation are disseminated through the central nervous system, which occurs initially into the white matter of the brain. So this is all about the pathology. But other factors also responsible for multiple sclerosis is the genetic, and for
Yes, once again, network problem. Sir, please unmute, sir. You're muted, sir.
hello, again we lost the connection. Am I audible?
Yes, sir. Yes, please.
Okay. Then let me share my screen again.
Yes.
Okay.
Yes,
Again,
sir.
we are back to the pathology. Can you see all?
Yes, sir. Yes, yes.
Okay,
Okay.
okay, fine, fine. Thank you. So we were discussing about the pathology, the plaques of demyelination along with the destruction of the oligodendroglia and perivascular inflammation. Because of the perivascular inflammation, they are disseminated to the central nervous system, which occurs initially into the white matter of the brain. But apart from this, there are another factors which is also playing a role, and we should consider that factor as well. And genetic factor we should not exclude. HLA, human leukocyte antigen, that is one of the responsible factor over here. Human chromosome 6 serve as a histocompatibility complex in this condition. We have also discussed about the environmental factor, the decreased sunlight, especially country like this in UK, we don't have much sunlight. So decreased sunlight, which is also responsible for the decreased synthesis of vitamin D in the blood, in the system. So decreased vitamin D, stress is also one of the responsible factor. Smoking is also one of the responsible factor for development and initiation of the multiple sclerosis. Occupational hazard and exposure to certain toxin and solvent. Vaccination, recently due to COVID, a lot of patient has taken a COVID vaccination, and that after the COVID vaccination, now we are getting certain patients with a neurological conditions and neurological complaints and low level of uric acid. So patient of gout never develop multiple sclerosis. Human herpes virus, which is also considered as one of the important factor for development of the multiple sclerosis. Okay, now we are coming to the homeopathic approach. That how homeopathy works on the multiple sclerosis. But before we go to the homeopathic approach, I have forgotten to discuss about the neurological examination, which is very, very important. we have to examine our patient neurological aspect. And if we suggest investigations, then we have to suggest the MRI scan. And here you can see this clip is showing that what are the parts should be checked during the MRI. Lumbar puncture, that already I have discussed about it will show the elevated IgG level in cerebrospinal fluid, and evoke potential test. These tests are very, very important. So at that time, they put the electrodes after telling patient to wash the hair completely, not to put anything, and they put the electrodes and they check with the evoke potential test, and that shows the potential diagnosis of the multiple sclerosis. Now we are coming to the homeopathic approach. Sorry, I have forgotten, and we jumped one slide. Okay, so homeopathic approach is very, very vital to treat the multiple sclerosis. Our master has described some symptoms in some remedy, and when we analyze the symptoms of the multiple sclerosis patient, we just correlate that symptoms with the materia medica. And let's see that. First of all, multiple sclerosis is categorized in a syphilitic miasm. And syphilitic miasm is always responsible for destructions and damage. Syphilitic miasm is always bring deformities, which we can see in a multiple sclerosis patient. Resolution, diminution of senses. Patient is slowly losing the control over all the senses, like memory, coordination. That's why patient developing ataxia. Patient is dropping the things from the hand. Patient feels lazy, indolent, lethargic. So, complete loss of orientation. Then, desire to self-harm. Patient is developing suicidal impulses. Patient wants to kill himself. Delayed convulsions or this multiple sclerosis patient never gets better because of the delayed convulsions and recovery. Patient is getting better.
Sir, please unmute, sir.
Today, the internet is causing a
Yes.
really problem. Network is causing real problem.
The
So have you
conducting defect. Yes, sir. This is the most interesting slide. If you remember the D theory with the multiple sclerosis, and this is the most interesting slide that you will get all the symptoms, all the clue with the D. Demyelination leads to destructions and damage, deformities, dissolution, diminution of senses, desire to self-harm, all the D you will find over here. Delayed convulsions, degeneration. This is a degenerative disease. It's autoimmune disease, inflammatory disease, degenerative disease. Patient is developing a depletion and drainage and wasting. When there is not enough nerve supply, or when the nerve supply has been interrupted, there is a wasting of the muscle. When there is interruptions of the nerve supply to the muscle, patient is developing ataxia, incoordination. And with all these symptoms that what the patient is suffering,
Patient feels depressed. Patient has a dullness of intellect. Patient having a diarrhea or constipation. Patient having a dysphagia. Patient having a dysarthria. Patient is developing a dribbling or incontinence. Disseminated patches of demyelination. Disruptions of mechanism of central nervous system. So everything is on the D. And why it happens? Why MS, multiple sclerosis, happens? Due to decreased sunlight, due to decreased vitamin D. So all the symptoms is here related with the D. So in multiple sclerosis, most widely used remedy is Conam maculatum. And the common name is also starting with the D, devil's porridge. You can correlate this as a doctrine of signature with the multiple sclerosis, commonly known as poison hemlock. Conam maculatum is containing a toxin that is conine. It is like nicotine, which disrupts the mechanism of central nervous system, causing respiratory depressions, collapse, which results into the death. And if we refer the materia medica, and if we refer the Conam maculatum, we'll find all the symptoms, which is 90% matching with the multiple sclerosis patient's picture. This conine medical use is sedative and antispasmodic. So in chronological order, I have made a therapeutic index of homeopathic remedies, which is working very well on the multiple sclerosis in my practice. One is Aurum metallicum. As we have discussed, the Conam maculatum is the drug of choice, which helps patients to improve certain symptoms. And Lathyrus sativus. Long back, this is a story of 1969. When I was a student in high school, and I haven't had no medical knowledge at that time. When you are a student, you don't have medical knowledge. But when you come across a news that many patients, they are developing a lower limb palsy, they are unable to walk, they have been hospitalized, and number of patients, they have been admitted in a hospital. So it was a sort of an epidemic in Saurashtra, Bhavnagar. I was studying in Bhavnagar. So I was surprised. But the newspaper media has shown that there is a special type of food that called the gantia. It is made up from the Lathyrus dal. It's a type of lentil. From that, they are making that gantia. And people were eating that every day. And on the sudden, being admitted in a hospital because
The network problem is again creating troubles in conducting the programs. And so we will join soon. Yes, joined.
Okay, again, we lost the connection.
Yes. Yeah.
And again, I'm sharing my screen.
Okay. This repetition of dose.
So at that time, I realized that why it was happening. Now I can realize, now I correlate it, that because of that dal, the lathyrus was causing the problem, and that's why patient having all this neurological condition. Phosphorus, another medicine. Physostigma, we know some. That is also a very good medicine for patients of multiple sclerosis to alleviate certain symptoms. Picric acid is irritant. Plumbum mat, drug of choice, you can say, just like conium and pulsatilla. Pulsatilla have mood swings, frequent mood swings. Patient is depressed. Patient wants to be alone. That all these symptoms that what multiple sclerosis patient can describe to you, that you will get from all this therapeutic index that what I have put over here from my practice. And Dr. Manoj was telling about the dose. So initially we start with the 200 potency, but here we need to do the frequent repetition with the conium, with the plumbum. And long back, when I was presenting on the IFPH platform, I showed one video of a lady after having a COVID. The patient was not able to walk properly, and after 2 weeks' time, patient started walking properly. So because of the vaccine, also patients are developing the symptoms like multiple sclerosis, and patient having some neurological outcome because of the vaccine, because of the right now in UK, there is a typical virus is going on, and that is causing a lot of problem. Every day, many patients having a complaint of this influenza-like symptoms. So there is an epidemic, and that epidemic is making patient's condition worst. Okay, so this all about multiple sclerosis. Hope you would have enjoyed it.
Sure.
And I want to present few cases of multiple sclerosis, but time is not allowing me to permit to
Yes, sir.
present. So we'll arrange a next session. In next session, I will also elaborate 3 cases of multiple sclerosis. They are not completely cured, but they are better.
Yes.
They are better. So thank you very much for inviting me on this platform. Really, I enjoyed sharing my thoughts, and thanks for listening me. And really, I appreciate all the noble work which IFPH is doing for the spreading the homeopathy throughout the globe. Really, I'm highly thankful to everyone.
Yes, thank you,
Thanks.
sir. A wonderful presentation. I must say it is an exquisite one. Always, with the beautiful presentations, the professional approach, as the slide preparations and your narrations are very excellent. No doubt about that. It's time for discussions. 5 to 6 minutes remaining. Those who would like to participate, please raise your hand. May I invite Dr. Sergi? Are you there? Dr. Sergi. She's very careful, always listening with eagerness. Dr. Sergi from Turkey.
Hi,
Yes, madam, please. What is your comments, please?
good evening, Manoj, and thank you, Dr. Trivedi. It's a wonderful session again. And multiple sclerosis is a very important disease, and every year and every time we see a lot of people. And thank you so much. And I want to ask you, how about Argentum phosphoricum or Argentum metallicum? How is your idea?
Yeah, I have mentioned about the Argentum metallicum, aurum metallicum. Yes, Argentum nitricum, Argentum metallicum, any Argentum, any silver, because silver having a property to heal the nerve. And for that, I will take a separate presentation on the Argentum nitricum. I have done so much research on the argentum, and I presented over here in HMA conference about the argentum. Argentum is a nerve tonic. Argentum is a preservative. Argentum here, a simple example. In India, if you take any sweet, they are having some silver coating.
Mhm.
Yeah. So in terms of doctrine of signature, that silver coating is preserving the sweets. The same way the silver is preserving the nerve coating. And that's why in war also, previously the silver nitrate was using to dress the wound. So
Yeah.
silver having a very good property, argentum nitricum, argentum metallicum having a very good property to treat the neurological condition. Yes, I do agree with that. And it's
Yes,
Thank
a
you.
nice question. Yeah.
Thank you.
it's a nice question as well as a wonderful answer with precision. Thank you, sir. Now,
Thank you very much.
yes, Dr. Mr. Taciturn, are you there? Another profession from engineer. He's always very scrupulous with meticulous analysis. Dr. Taciturn, are you there?
Yeah, I am here.
Yeah, please. What is your opinion as well as comments and doubts, please?
Yeah, thank you very much for this nice presentation.
Thank you.
I have one experience with Costicum, successful experience. What do you
Definitely.
think
Yes, sir.
about that?
100%. I do agree with you. Causticum having a very good property for all the neurological condition. And initially I mentioned about the causticum for the nominal aphasia because we treat patients on a mental aspect first. So patient when developing a hesitancy in a speech, incoherent speech or dysarthria, so patient is always coming with the nominal aphasia. Patient doesn't want initially to show all the symptoms because it's a slow progressing disease. So I do agree with you and really appreciate to remember the causticum. Thank you.
Thank you
It's very
also.
good remedy.
Yes, thank you. There is a question in the chat box. Please guide about the use of Oromet. So there's a question in the chat box. Please guide about use of Oromet.
Aurum met.
Yes, sir.
Aurum means gold. Gold, argentum and aurum. They are very good remedy for any type of neurological condition, but we have to consider the mental aspects first. And aurum having a tendency to commit suicide. In the same way, the multiple sclerosis patient having a tendency, suicidal tendency, aurum patient is also depressed. This multiple sclerosis patient is also depressed. So we can correlate the drug picture with the patient's complaint picture. So aurum met is a very vital for the patients of multiple sclerosis. Thank you,
Yes.
Dr. Sunena.
Yes. Any doubts? 1 or 2 minutes remaining. Anyway, nice presentation about especially you have presented the cause, effect, and therapy is wonderful. Then the therapy, the practical application or the cases will be present the second part 2 as according to your convenience, sir. Then you mentioned about the central symptoms, the speech, musculoskeletal symptoms, bowels, urinary symptoms, everything. So, and each and every person can remember with ease. That's the most important. You mentioned about the slackness, the pulsatula, the changeability of pulsatula, then the gelsemium, the dysarthria, the difficulty in talking, all this very nice one. Then,
Lachesis.
yes, like this. Then I think there's an important different diagnosis there with benign BPH, benign posterior hypertrophy, and this one, this the urge incontinence. That each and every person must be very conscious about that, because normally we think that this may be due to the prostate problem, but what is really happening is that these multiple sclerosis, especially after the viral infections and as well as the vaccinations. So I think homeopathy is a long system of medicine which is hopeful in treating such cases. May I invite Dr. Geeta Madam, the former pathology professor from Trivandrum Homeopathy Medical Government College. Madam, your comments as a lot of thanks. Are you there, Dr. Geeta Madam? Yes, madam, please unmute.
So, good evening, all. Sir, it is very difficult to understand the symptoms of multiple sclerosis, but you made it very easy, sir. Thank you very much. All the demyelination symptoms, symptoms of this eye symptoms, etc. I think in Oromore also, we are getting the same symptoms. In Lotus
Yes, sir.
Metinamerica,
Yes, ma'am.
multiple sclerosis is specially mentioned there, along with all the symptoms of the limbs and eye symptoms. Gelsemia is also a good remedy for this. I think so. Sir, what is your opinion? Gelsemium and aurum muriaticum.
Yeah, Jalsemum is working very well on any neurological condition, that what I have earlier mentioned.
Sorry.
Jalsemum, aurum mur, aurum mat, argentum, every metals, plumbum. If you look to any matter, any metal, right, they having some tendency to treat the neurological condition. And that's why we are giving more importance to the plumbum, causticum. Causticum is not a metal, but still causticum bears a very good importance in neurological condition in homeopathy.
We have explained the etiology very well. The association with the EB virus, Epstein-Barr virus.
Epstein-Barr virus, yeah.
Okay, it is otherwise, it can cause, I think it has got a special affinity towards the nervous system, this virus.
Yeah. Yeah.
And it is
Madam,
causing
what of that,
infectious
please, madam?
mononucleosis, Burkitt's lymphoma, etc. also. It is a, and the virus belong to DNA family and causing the demyelination like all other viruses.
Okay.
And that's why pulsatilla is very good for that.
Then this measles virus, rubella virus can also affect the nervous system.
Yeah.
Excuse me, madam. Stand to wind up. Please express sort of thanks, madam.
Okay. That is.
Okay, thank you very much. And
Am I audible, madam? Please express sort of thanks to Dr. NIKUNJ, sir. Madam.
Myself.
Yes, yes, of course.
Oh, okay, sorry. So, very nice presentation and highly informative and thought-provoking. So, then I really express my sincere thanks on behalf of this IFPH and from my personal side. Thank you very much, sir. Thank you all.
Thank you. Thank you.
Okay,
IFPH
well,
is
that's
doing a
all for
very great
today's.
job.
Yes, today's English edition. Hope you will be back again tomorrow. Till then, goodbye, and Dr. Shaila to continue the program in Malayalam. Thank you.